Scotland's Queen's nurses are changemakers, social reformers, expert practitioners, leaders, facilitators, role models and pioneers of new ways to improve health. In 2017, for the first time in almost 5 decades, the Queen's Nurse title was awarded in Scotland. Since then, at least 20 exceptional community nurses and midwives have been nominated each year by their employers and selected for the 9-month Queen's Nurse Development Programme. It is unlike other improvement and leadership programmes, as candidates explore who they are in creative and contemplative ways, so that the changes in themselves enable change in the lives and life chances of others. During the programme, they focus on an issue of importance to their community and work with a coach, identifying what needs to improve in order to make a lasting difference.
Now there is a Queen's Nurse in every corner of Scotland, from remote islands to large cities. They are tackling inequality and improving care for some of society's most marginalised groups in new and more effective ways, redesigning addiction services around the needs of individuals and families, working with third sector partners to signpost help every day of the week for those who are homeless, finding better ways to support people's mental health, whether introducing life-changing conversations in police custody, enhancing mental well-being for workers on offshore platforms, or advocating powerfully for people with dementia and their families. Queen's nurses are working alongside pregnant asylum seekers to ensure that vulnerable new mothers can access the care they and their babies need to thrive. They're finding new ways to help teenagers look after children and people with learning disabilities make positive choices about their health.
Queen's nurses include district nurses and community children's nurses, health visitors, community midwives and school nurses, as well as those working in general practice, in care homes and in prisons. They bring high-quality specialist healthcare to people in deprived urban neighbourhoods and in remote places. They create compassionate communities, harnessing the power of social media to engage volunteers and ensure that no one dies alone. And they do all this while sharing their learning and expertise with their colleagues, their patients and their communities. Together, they are building a social movement, connecting with each other, with other improvement leaders and community activists, to work collectively for social justice. Through the programme, their expert clinical knowledge and skills are enhanced by developing a new self-confidence. They have greater influence in their communities and within their professional networks. Queen's nurses are making a difference, not only to individuals and families, but across health services, social care and public health. As Queen's nurses, they're using their voices to ensure that policies, practices and systems become more person-centred. Following in the footsteps of the Institute's 19th century founders as radical social reformers and pioneers, today's Queen's nurses are true catalysts for change in communities across Scotland.